All right, Beatrice is here now with health news, and we're going to talk about HIV-AIDS. It is now, of course, a treatable disease, thankfully.
But HIV-AIDS is far from under control. In fact, we have some shocking numbers tonight in new infections, something parents should be aware of, Bea.
Indeed, and they should be talking to their children about it. Many of the new HIV infections are among young people in their teens and early 20s, and many of those infected don't even know it.
Hi, how are you? Hi.
At the AIDS Committee of Toronto, there are counselors available and lots of information to educate yourself on HIV-AIDS, a knowledge base that seems to be declining.
It actually showed that the difference in knowledge among young people related to HIV in 1988 to 2002 had declined. So it showed that young people aren't as aware of HIV and AIDS. 1/4 of new HIV infections are among youth 13 to 24 years old, according to a new report from the U.S. Centers for Disease Control and Prevention. 60% of those people don't know they're infected. Those at highest risk were gay and bisexual boys and men who reported higher levels of risky behavior and the use of drugs and alcohol before sex. When you're young, you take risks, and you don't often think about the consequences of it. Ironically, part of the problem may be that HIV-AIDS is no longer considered a death sentence.
The numbers have not gone down, especially not in the younger population. So I think in some of the patients I see, there's a sense that if they get HIV, they'll take a treatment and it won't be such a big deal. It still is a lifetime of having to take treatment with side effects and other complications.
Many youth don't get tested, and many aren't sent for tests unless they are considered high risk. This world-renowned HIV/AIDS scientist and other doctors recently called for routine testing to be offered to every sexually active person in the country.
If you've been sexually active once in the last 5 decades, you need to do a test so that you confirm that you're HIV negative. If you remain sexually active, you should repeat the test once a year. If people who have greater risk because they have multiple sexual partners, they're injection drug users or the like, they should have the test more often, probably every 3 months.
Canadian figures appear to show the same types of numbers in terms of HIV infection in youth.
All right, Bea. Thank you.
You're welcome.